वो कर रहे हैं। कर दीजिए, आप कर दीजिए, कर दो, मैं कर दो।
Hi, good afternoon. I'm Dr. Soumya, consultant Site Avenue. Hi, good afternoon. I'm Dr. Soumya, consultant Site Avenue. I'm a trained aesthetic physician by American Academy of Aesthetics. And today I'm going to tell you very interesting things about Botox. Now, when we listen to the word Botox, the first thing that comes to our mind is glamour, aesthetics, models, actors, and actresses getting it done. And rightly said, Botox is the world's most common non surgical aesthetic procedure that is being done worldwide. It is as famous in India as it is outside. Now, apart from that, Botox has got some really good functional values also, and it is used in some clinical diseases as an adjuvant therapy. And today I'm going to share some light on the uses of Botox in ophthalmology. Now, to start with, let me tell you and explain you guys in a very simple language that how does Botox works. So for that, we need to understand a very basic model of muscle fibers. Now, when the brain sends a signal to the nerve terminals basically sends neurotransmitters to the muscle bundle and the muscle contracts. Now, Botox basically helps in preventing the transmission of these neurotransmitters in the muscle bundle and thereby causing a temporary paralysis of the muscles. Now, the word temporary that I used is very important because this is the phrase that I'll be using again and again. After like 2 months of the administration, there are new terminals which emerge and extends towards the muscle surface, thereby re-establishing the motor unit. So usually by 3 to 4 weeks, the function is back. The total time span for Botox injections and the total time span for a muscle to get back into its action is it usually takes 3 to 4 months actually, depending upon the strength of the muscle. Now, I'm going to tell you about some common myths about Botox. Now, one of the main questions that comes when people come to our consultation room is, does Botox makes you look older once the effect waves off, or this Botox is addictive? Like, I would like to take these points together because Botox is not addictive. The addiction is the look you have once achieved because of the Botox injections. Now, when you have Botox and the effect is full, you no longer have those fine lines which you had already. So it doesn't make you look aged, but it is the a return of those fine lines that were already there in you, and hence you think that you've got new fine lines. So Botox does not give you new wrinkles. It when the effect wanes off, the wrinkles appear once again. And the addiction is the looks, believe me, it is not the Botox. The second most important question is, does Botox give you instant result or instant gratification? No, not at all. Botox at least take 3 to 7 days to act. And depending upon the first and the second sitting, if a person has come to us for the first time, we would like to give lesser units of Botox to that patient, and later in the second sitting, we would like to do some top ups so that the patient have those kind of effect. So no, it's not an instant thing, it takes time. Now, Botox and fillers are the same. No, no way. And some of the pictures that are circulating on the internet that Botox freezes your face, it's a biggest myth that people have. Botox and fillers are not the same. Botox is used only for dynamic wrinkles, and fillers add volume to your face. Now, the last and the most important question which people ask me is, does Botox only treat wrinkles? No, Botox does not only treat wrinkles. Botox has got some really beautiful functional values and we use it clinically as well. So, now adding on to that knowledge, I would like to talk about some functional properties of Botox as well, and why Botox is used as an adjuvant therapy. Now, for most important condition that we have right now is blepharospasm. Blepharospasm is basically a forceful eyelid closure. As you can see in the picture, it's a forceful eyelid closure which is very dysfunctional. Patient is very uncomfortable, and this is because of spasm of your orbicularis muscle. Now, what is an orbicularis muscle? Orbicularis muscle is a muscle that is a circular muscle that surrounds your eyes. So the spasm of that muscle causes the repetitive forceful eyelid closure, and the patient is not able to open the eyes. So we basically rule out all the neurological disorders, and once all the cause of this of the blepharospasm is ruled out, then we decide on to give Botox. And believe me, it is a very regarding procedure for patients who are suffering from blepharospasm, and they are really happy after the treatment. But the only thing is that the effect stays, as I've already said, the effect stays for 3 to 4 months, and you need to have repetitive injections for that. Now, the second most common condition is in hemifacial spasm. Now, what are hemifacial spasm? As you can look into this picture, this gentleman has come to us with a one-sided spastic face. The facial muscles of this gentleman has some contractions, because of which there is abnormality and non-uniformity between the two halves of the faces. Now we decide on to which is the target muscle that needs to be injected on, and we give the Botox accordingly. And you can see the after treatment effect. The patient is looking absolutely normal. You can't even make out that patient has suffered anything in the first place. Now, having said that, these all are the condition in which the other causes are absolutely ruled out. Now, one of my favorites is the use of Botox in temporary tarsorrhaphy. Now, this is a very useful procedure in which a patient is suffering from other palsies like seventh nerve palsy, which is a Bell's palsy, or a diplopia, or a lateral rectus palsy, in which the patient starts having diplopia. We often tell the patient to basically tape the eyes, but routinely the patient sometimes forgets, or the patient is sometimes careless, and there is a infection of the intraocular structures or the cornea that is infected. So in those cases, instead of taping the eyes, we give patients Botox, and that leads to closure of the eyelid, and that takes care of the waiting period for the recovery. So the Botox efforts also stays there for 3 to 4 months, and the whole Bell's palsy or lateral rectus palsy or any nerve palsy also recovers during that period in time. Now, another thing which we can use Botox on is spastic entropion. Now, what is an entropion? There are certain muscle fibers which are just below your lid margin in the lower lid, and they go into spasm. Now, that because that causes interning of your lid and the rubbing of your eyelashes over the cornea. So, when we give Botox here, the muscle fibers are relaxed. There is the at least the patient is relieved of little bit of ocular irritation and further spasticity till he is ready for a surgery of the lid. Now, coming to another condition where we give Botox is refractive epiphora in patients with other disease processes, which where we want to decrease the production of tear glands for time being, or we are waiting for another surgery to take place. We give patient Botox in the lateral part of the palpebral lobe of lacrimal gland, and we are sorted. Now, another very basic Botox injections are given in patients with strabismus. Now, these candidates are those candidates who are borderline surgical cases. They are suffering from mild to moderate strabismus, and or probably who cannot undergo any surgical procedure. So in those patients, we give Botox to the muscle which is pulling the eye outward, and 2.5 to 5 unit of injection is sufficient. There is no way to gauge actually how much unit will cause how much of deviation, but the point is that it will really help the patient. Now, for certain conditions like chronic dry eyes, the medial part of the upper and lower eyelid is given Botox to minimize the lacrimal pump in case of severe dry eyes. These are the conditions in which patients do not want to go any other surgery. They are very irritated because of the conditions. Now, coming to the second section of my talk today, which is the cosmetic uses on face, and which is the most interesting and most awaited section of the talk. So, coming to the cosmetic uses by which the Botox is basically known for, we can use Botox treatment in cases of migraines, where we minimize the frequency and severity of migraines. We treat frown lines as in case of, now pardon me because I'll be going front and forth with the slides. Now, this is the forehead wrinkles that the patient is being treated from, and this is after your Botox treatment. Now, coming to your others, frown lines is the center, the globular frown lines that you basically get, and then the patient is treated because with Botox for these. Other things are the under eye lines, which can be treated with Botox. Now, the basic concept of treating any patient for wrinkles in Botox is that Botox only takes care of your dynamic wrinkles. It does not take care of your static wrinkles. Now, what I mean by dynamic wrinkles? Dynamic wrinkles are wrinkles which comes in and goes off once you stop using that muscle. So if I say that I smile and I have these wrinkles, and when I have a straight face, there are no wrinkles. So those are my dynamic wrinkles. Those are the only wrinkles that can be treated with Botox. For static wrinkles, those which are present even with a straight face, you need to have fillers. So basically, what the need of the thing is that you really have to go and consult your physician. You have to tell your physician what you actually want and what are you actually expecting. Now, the most common wrinkles that patients come here for are crow feet wrinkles, which are known as the smile wrinkles. When you smile, the orbicularis muscle here creates line of series of wrinkles. Now, if they are dynamic, Botox is an absolute bliss for this condition. But static wrinkles, as I've mentioned again, is not treated by this Botox, and we need to have fillers for that. These are some other conditions that you have. Now, what is the eligibility criteria for Botox? Anybody who's 20 years and above can go in for Botox. Now, Botox nowadays is taken as not as something which is only for the high-end people, but it is taken as a preventable measure for preventing any wrinkles from getting from stage 1 to stage 4. What I mean is from getting any wrinkles from dynamic to static conditions. And as I've already told you this, that Botox works only on dynamic wrinkles. Now, coming to my contraindications of Botox, patients who are pregnant and who are lactating are not a candidate for Botox, and of course, patients with allergy to Botox are not a candidate. The local skin infections and neuromuscular disorders, because their neuromuscular junction is already affected, and we do not want to induce any further neurotoxin into the body. So we do not give Botox in those patients, and patients on muscle relaxants or aminoglycosides, because again, these are the patients with affected neuromuscular junctions. Now, what is the take home message from this whole talk? The take home message is that you have to go to a consultant who's well trained. You have to talk to your consultant out that what are your expectations, and then your physician will tell you that whether your expectation is matching the reality of the treatment or not. The physician should be well trained. He should exactly know what is your target muscle, what are you wanting out of that, and together you will be a happy patient. So if you have any doubts or any queries, please ask us in the message box. We have a site avenue centers in GK1 and Gurgaon and many other new places in Delhi and NCR. Thank you so much. Any
Thank you.
questions, please?
Yeah, thank you, doctor. One of our subscriber wants to know that what areas can be treated with Botox.
Uh, as I've already told you, ma'am, there are areas which are starting from your forehead. So you can have patients who are coming with forehead wrinkles, like here. So you have forehead wrinkles here, so you can treat that. You have frown lines which are in between your eyebrows. You have crow's feet which are around here. Then your underline eyes which are here. Then smoker's line, bunny lines which are here. So anything on the face with dynamic wrinkles, that means the wrinkles which come and goes with the expression, those are the areas which can be treated with Botox.
And how does this Botox actually work?
In the starting of my talk, I already told you that Botox is basically okay. Fine. So let me tell you again. We need to understand the basic model of how a muscle works. Now, the brain sends a signal to the nerves, and the nerve sends a signal to the muscles, and the muscle contracts. This is how a muscle works. Now, Botox basically, what Botox does, basically, Botox stops that nerve transmission into the muscle fibers, and there is no transmission of the muscle, and there is stoppage of muscle contraction, and the muscle is in temporary paralysis.
Does taking this Botox hurt to the patient?
I wouldn't say it hurts to the patient, because most of my patients, if they are going in for second or the third round, they do it without anesthesia. But some patients do complain of some stinginess in the areas where it is injected. But other than that, there is no pain actually. But for the first timers, I always apply a local skin anesthetic, so even the smallest prick is not felt.
So one of our subscriber, Mr. Sandeep, wants to know when will I see the results of Botox if I take it?
See, Botox does not give you immediate results. Botox takes around 3 to 7 days to work, and it also depends upon which target muscle are we targeting. So, if you are a first timer to us, we don't know how your muscle behaves. We don't know how strengthful your muscle is. So, we give smaller units of Botox and would ask you to come back for a top up later. So, obviously, you have to work with us. It's a process of a week at least.
And how long does this Botox last once injected?
For areas which are with weaker muscles, it lasts from 4 to 5 months. For areas where, as for an example, if we are injecting Botox into the glabular area of males, then the effect lasts for 3 to 4 months. So basically, it depends upon the muscle strength, but usually 3 to 4 months.
One of our subscribers, she's asking that her daughter is 18 years. Can she start getting Botox at that age?
Yes, 18 and above can have Botox if the person is too conscious about these dynamic wrinkles that the patient is having. They can anyways go Botox. So Botox is nowadays getting into preventable treatment rather than a treatment for problems that have already occurred. So as I've already told you, it works very well on dynamic wrinkles. So at a young age, getting Botox after 18 is a good idea.
And are there any side effects of Botox, or is Botox actually safe?
Yes, Botox is an absolutely safe procedure if given by a person who's well trained, who has a beautiful knowledge about the muscles, their actions, and what is the expectation of the patient. So, if a trained physician is giving you Botox, it's absolutely safe.
Thank you, doctor. Those were the questions.
I have one question, doctor.
Yes.
I just wanted to know whether all of the lines are treated at the same time, or is it a step-by-step procedure?
We treat all the lines at the same time, but maximum units is 50 to 100 unit at a time. So one sitting we can give maximum to 100 units, not more than that. So if it is covering your whole face, I would like to divide it into three sittings and do it. That's more comfortable to the patient actually, and we also know that how patient reacts to the whole thing.
Yeah, and how many days of leave should I take if I want to undergo this?
It's an OPD procedure. It's a painless procedure. People come in their lunchtime, get the Botox injections done, and go back to their work. You don't have to take any leave. There will be no trace if it is done by a expert. And the maximum what you can feel is little bit of redness and little bit of pain at the site of injection, but usually patients do not complain of that. It is like very minimal.
And can I use my makeup on top of this?
For at least 7 days, I would suggest that you should not rub your face also, so there should be no facial. You can use your makeup after 2 to 3 days, I would say, but not rubbing or massaging your face, because that can lead to infiltration of Botox in the adjoining areas.
And how do you map the results basically?
We take series of photographs, and for the first timers who visit us for the first time, we take before and after pictures, and then we see how well the patient is doing. If we see that the patient is, if there are any residual wrinkles out there, then we do top ups to that patient. We take another serial picture. So by the time you are done with us with the first sitting of your Botox, which might need 2 to 3 top ups. By the time you come after 4 to 6 months for your second sitting, we actually know how your face behaves, and then the subsequent sittings are less.
Yeah. And doctor, one more question: is this Botox treatment covered in insurances?
No, it
private
is
and
not. It's an aesthetic procedure. Till now, Botox is not covered in any of the insurance policies.
private? And ma'am, how common is it that the people get this Botox treatment done?
Uh, Unfortunately, people don't talk about it, but I do have many patients, and I'm talking here, sitting here, so that tells me that Botox is very favorite among crowd, but people don't talk about getting Botox done. But I would say that there are most of the people do get Botox, and especially who have public dealing, they do get Botox. And Botox is not only for cosmetic reasons; some do get it for their functional abnormalities also, and it really helps.
Thank you, Dr. Soma. That was a very informative session. I hope our listeners will benefit from that. And we can just end the session by saying that if they have any other queries, they can write it in the inbox and we'll revert back.